Hello, I'm Dr. Sundari Mace, Sonoma County's health officer, and I'm here to share the latest updates on coronavirus in Sonoma County as of today. As of June 9th, we have 671 confirmed cases, up 7 cases in the last 24 hours. 297 are active, 370 have recovered, and we have the 4 deaths that we have been reporting. We've done 32,125 coronavirus tests to date, with 400 of these tests in the last 24 hours. So today I'm going to talk some about staying healthy as we open up the county. Summertime is officially approaching, and I know everybody wants to go outdoors and be in the parks and be involved in outdoor activities. But we do need to be mindful that the novel coronavirus does remain in our midst. Thanks to all of you, the Sonoma County residents, our community has made great progress in slowing the spread of COVID-19 here in Sonoma County. This progress and all of our testing and all the mitigation measures that we put in place allows us now to ease more restrictions on businesses and activities with an eye towards being in a position later this month to transition to stage 3 of the governor's resilience roadmap and open up even more. That would be by the end of next week. That being said, these decisions are to continue reducing or relaxing restrictions on commercial activities and use of public spaces are based solely on local conditions per the governor's variance waiver. And that includes such factors as we've always discussed as rate of the new cases per 100,000, hospitalizations, deaths, the availability of ICU bed capacity, the percentage of cases occurring due to community transmission, et cetera. Capacity to test the general population, follow cases, and trace contacts, protect those that are most vulnerable to the disease are also really important factors. So this does include sufficient supplies, equipment, hospital beds, and healthcare workers for the county as we move forward with reopening. So what does it take right now to keep our community moving in the right direction? We need to be as relentless as the virus. So that means we need to continue practicing the 6 feet of physical separation in public spaces while avoiding crowds as much as possible, wearing the facial coverings when physical distancing guidelines can't be followed, especially indoors, in grocery stores, pharmacies, other indoor settings. Getting tested, particularly if you suspect you've been exposed, and definitely if you're symptomatic with any of the symptoms that we have put forth on our website. Abiding by all the public health orders, cooperating with county disease control professionals by following isolation guidance if you test positive, quarantine guidance if you suspect that you've been exposed or have been told that you're contact to a COVID case, providing information to contact tracers should you be called so that they may notify individuals of potential exposure and provide guidance on protecting and promoting the health of themselves, their households, and the community. In terms of this pandemic, we are not out of the woods yet. We will be following the case rates and all the data very closely as we move forward with the opening. Although the nation is making strides in studying the novel virus, fast-tracking work on a vaccine, accelerating research and effective treatment, we are seeing a spike in cases in many parts of the country following widespread opening and relaxing and mitigation measures since Memorial Day. In addition, many people are exercising their First Amendment rights by demonstrating for equity and equal protection sparked by the recent killing of George Floyd. These rallies, by their nature, do place people close together where face coverings and hand hygiene, avoiding touching your face, mouth, and eyes is very important. So please keep your guard up because COVID-19 is relentless. You can learn more about free testing, what to do if you or someone you know tests positive, and how we as a community are doing in reducing the spread at socoemergency.org. Our community question today is, we've been getting many questions on what's now permitted under the recently modified health order. Can I exercise outside, take my kids to the park for fresh air, go to the beach? Yes, it's okay to exercise outdoors and participate in healthy activities as long as you follow proper hygiene and distancing requirements. The new health order permits groups of 10 people who do not need to be members of the same household to engage in outdoor recreation or sports, including at parks, outdoor recreational businesses, outdoor recreational equipment rental businesses, guided or chaperoned outdoor recreational activities. The order prohibits direct physical contact with other people who aren't members of your household, no tournaments, competitions, or other sporting events, no live audience activities, and recreational campgrounds remain closed at this time. Another question we have gotten is, can I purchase items from a retail store? Yes, all retail businesses, including indoor rental, shopping malls, strip malls, outlet malls, shopping centers, swap meets, are now allowed to operate. While out in public, people are encouraged to comply again with physical distancing and proper hygiene requirements. I encourage all retail stores to continue to offer their customers with curbside delivery or shipping options. Persons at higher risk of severe illness for COVID-19 should consider using curbside pickup, delivery, or shipping options. So thanks for joining me today. Please continue to take care of yourselves, stay healthy, and we'll talk again in 2 days.